Welcome to the Java Cafe, Java fam.
Let me show you something.
Good morning.
You mean you don't trust the police?
Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Today is the first Tuesday of August in 2022. And as you know, every first and third Tuesday, we bring some guests in the room to talk about Your Healthy Java, which is sponsored by the Massachusetts General Hospital Office of Equity and Community Health. But today, we're not really bringing in guests. We were talking a couple of weeks ago and just sort of came to the conclusion we're going to do sort of a midsummer check-in with the team. If you're not familiar with the team for Your Healthy Java, you are about to meet them now. But listen, do me a favor, go and hit that share button, hit the like button, and invite some others to come into the Java Cafe for Your Healthy Java. We're kind of informal today. And so let's bring in, I'll call her our associate producer of content and community engagement and marketing and something else she does formally at MGH. But Cindy Diggs is here. And then no stranger to the Java Cafe, Dr. Alabre. And so we're just here this morning. We're going to do what I'm calling a midsummer check-in, maybe be a little bit all over the place and just talk about community health, things that are going on in our community, and some things that we've been thinking about doing here for Your Healthy Java. So we'll start, ladies first. Cindy, say good morning, and however you want to greet the people, and I'll need to tell you what to do.
Good morning, Java family, and to the Java mamas.
Dr. Alabre, go ahead and say good morning, sir.
I can't top that. Good morning, everyone.
Mama Javas. Okay, Props and I call them the Mother's Board, but they are definitely here. Sharon, Cornelia, Sister Debbie, Leslie. I think that is it. And I think is Mama Java. Oh God, I'm going to get in trouble. The Mama Java is in the room. But Dr. Labre, how are you, sir?
I am doing well, thank you.
That is good to hear. And so, what we should do some formal, check-in. I know there's a lot going on in the public health realm. There is monkeypox. There is the I was going to say NBA. There's the NB5, NA, BA5.
Yeah.
Okay, BA5. And so numbers are sort of interesting, but I did hear this morning that as far as, and it's, just hear us out. One of the ways that the city of Boston and other cities look at the COVID rates is through wastewater. And I did hear this morning that the percentage is going down. So there is some sort of good. So Dr. Labre, let's do sort of informal but formal. From your perspective, where are things? Just a quick check in there.
I thought we were going to start with the fun stuff.
Okay, we can save that for the end, or we can start with the fun stuff. I don't want to say it out the way, but
Let's start with that and then uplift people with the fun
All
stuff.
right. I mean, it's not that bad. As you said, we've been through this. There is certainly going to be up and down in this whole sort of waves and a little bit of a lull and whatnot. So the messaging hasn't really changed that much. Do the best that you can, and hopefully everything is okay. I think that's the positive sort of way. Yes, the numbers, looking at the wastewater has dropped. That doesn't always correlate perfectly with what we're seeing in the community, but it gives us a sense. And so there can be a lag behind in symptoms and cases we are seeing quite a few number of cases. And I just got an email from the hospital that the emergency room is at capacity disaster. So lots of people are in. It's not all COVID related, but I'm saying we are all. And so it is still good to do the best you can and prevent you from needing to go to the hospital because it's full everywhere. So you don't want to get to that point. And the best we can do right now is, again, get boosted if you're eligible, get vaccinated if you haven't been there yet. I hope most people or everyone is already there. It does reduce the severity. I know it gives people pause knowing that you can still get it, but the difference is huge versus the vaccinated getting COVID and the unvaccinated COVID. It's not the same. It's not. It's still big no matter what variant we have. We're still getting some benefit from it. And people who are 50 and older, or if you have medical problems, get boosted. And if you do get COVID, reach out to your doctors who may be eligible for the pill, Paxlovid. There are some criteria that you have to meet, but if you are eligible, do that. That also reduces the risk of hospitalization and severe illness. So we're just, again, same thing, get yourself vaccinated, get yourself boosted, and stay in touch with your doctor.
That's the best advice. And it's nothing that, and we're going to go back to this in a second, but it's the central messaging that we've been saying ever since we've started, even beforehand. And so one of the other things, and I'll go to Cindy more, not so much around the health perspective, but one of the other public health issues that public health, and I would say for some that are part of the LGBT or gay men, is also this piece around monkeypox. It is a viral disease. Now I'm not the doctor, but similar to like varicella, like chickenpox or whatever. And with the health piece of that, which we talked about with Dr. Sanchez, but there's sort of this, and I've noticed some materials from the Health Commission where they're trying to talk about taking away the stigma around that. Now, do we state fact that according to the testing that they're able to do right now, the biggest population that has tested positive and dealing with monkeypox are men who have sex with men. That is the biggest population. But we want to ensure, and Cindy, jump in here, that, we be real about taking, and I think Dr. Sanchez talked about this, not applying a stigma to this particular disease, because there are people who don't have sex with men who got monkeypox. And so, Cindy, you had mentioned that you were doing the work early on. And it's so interesting because even with like the COVID vaccine, the monkeypox, I think people that move in public health automatically are going back to like what we would probably say outside of COVID was the biggest public health issue around HIV. And so, Cindy, jump in here around what you're hearing, observing, and what you'd like to share around monkeypox.
So I just wanted to remind the audience of the doctor that you had on that explained why those numbers are so high, is because gay men go to the doctors more often. So obviously they're going to be tested, and that's how they're finding out that they have that virus. And I will talk about my experience working in the HIV field before I even got into that field. So back in the 80s, my first job was at JP Legal Services, and I was the interpreter there. And because I was an extra person on staff, I was often called in to be a witness to the young men at that time signing their wills because they had contracted AIDS. And it was a very difficult time for me. I was 21 years old and watching people that were my age signing their will. And everyone wanted to refer to it as a gay disease, but that's just where it was at that time. Those people were going out to be tested and going into more often to the doctors. But I know that when I was in college, I won't say where, but we were voted one of the most promiscuous colleges or universities in Boston. And so, that disease traveled, but no one wanted to put the word out there that way, that it was young people that were having unprotected sex. So fast forward probably about 20 years, I got into the HIV prevention world and was one who went into our communities and distributed condoms and always worked in the adolescent clinics and distributing condoms to young people who were having unprotected sex. And rest in peace to Irving Golson, who was
Yes.
a person who was behind that force back in those days
Mhm.
in the 90s and early 2000s. So I think that we all need to be aware of this virus, and I'm glad that you're bringing it back up. But do not try to place blame on any population of people, because it is a disease that everybody can get.
Absolutely. And so we couldn't be in this space, all of us. And I'll kind of go back to Dr. Alabre with this. So maybe Cindy, I'll start with you and then come back to Dr. Alabre. But we have been in this, you and I, in sort of the public health outreach, youth development that you just mentioned. Dr. Alabre, you've spent basically your life from the first time you took biology until, to some extent still, training now in CEUs and things like that. And so, Cindy, I want to ask you um, why do you dwell in this space? Why is public health so important to you?
I think because of that, I witnessed those things early on in life. And after I left that job, I went on to work with senior citizens and watch them deal with Alzheimer's and trying to help them have the best years, the rest of the years that they had. And then it was just a path that I was put on. I just kept going from there on and on and on. And I started off at Dimick. And then I was asked to work with the teen center, if you remember Anthony Robinson and Darren Clark at that time. And that was my introduction back in 2000 to youth work. And I ended up leaving there and going to an organization called GOAL, the Greater Options for Adolescent Lives. And it was teen pregnancy, HIV, and STD prevention that I did. And it just was, that was the rest of my life.
And it just took off from there.
Yep. So 22 years in this field.
Wow. Now, Dr. Alabre, how, and we're going to get into the midsummer check-in. So, Cindy, I'm going to come back to you, and then we're going to talk about. Look at the cup. She's showing off her original cup. Dr. Alabre, why? And we did your why, before, but why public health? Why is it so? I'll frame it differently for you. For Black and Brown communities, this equity piece. Why do we dwell in this space? Why is it something that we even care about?
Yeah, I think
segment.
There's certainly a lot of factors, but the biggest thing for me is that I've always been a very strong believer in knowledge is power. I grew up with that. That was sort of like a cultural family approach to how you sort of can empower yourself and better yourself is to learn, go to school, get an education, get educated. And so with that, I also have that strong sense of if you have it, you get to share it. And sort of similar to Cindy's story a little bit, I did my medical school at BU. So I was at BMC for a good portion of my time before I went to training residency at MGH. And so I did witness a lot of disparities, a lot of differences in how people approach care and how they are cared for. And I still found on many, many occasions that knowledge was part of the lacking factor to how desperate sort of the care was for some of these people. And so by providing just a little bit of education, a little bit of understanding, you can make a huge difference. And so that's sort of really one way to summarize is that you can make a difference with just that one piece. And so part of my work now is sort of trying to get the word out and letting people know I still meet people who obviously don't know about, say, Paxlovid, for example, like that it exists, that they can get it, that they can have access to it. There's a whole sort of campaign going on right now from the public health arena all over the country, certainly in Massachusetts, to just get the word out. That's why we're resorting to commercials and TikToks and whatever it is. And so because we know that knowledge does make a difference, it is power. And so that's sort of the best way I can summarize it.
Okay. We're going to switch gears just a little bit because we also, all of us work hard. We move in this space. It's summertime. We talk a lot about self-care. And so we'll move into the fun stuff as you mentioned earlier on. So Dr. Labre, you play tennis, you know, do other things. What have you been doing this summer to sort of keep yourself healthy, both mentally and physically?
Yeah, I think I'm a huge lover of the outdoors, and so summertime is certainly a great time for me. I do enjoy it in the winter as well. I actually don't mind the cold, believe it or not. But I do a whole lot more in the summer when it comes to being outside and exercising. So we do know exercise is a huge part of staying healthy and just being active in general, and whatever exercise you can do. So I try to take full advantage of that. I do play tennis, as you mentioned, and so as much as I can get out there, I do.
You win?
What's that?
Do you win often, or
that's a really good question. Interestingly enough, that's the one thing I'm not very competitive at. I'm super competitive when it comes to racquetball, but tennis, I just enjoy it. Like I don't really, I mean, obviously you want to get the shots in, but it's not about the winning part for me. It's just
really
being outside and hitting.
I'm kind of surprised because I could see you being on the court like focused, but you know, going. So racquetball is a little more assertive.
Oh yes, so that I will be. yes. So we all have our things, and so I do also enjoy running and hiking. So I do as much as I can. And there's lots of health benefits, both mentally and physically. So that's also where I get sort of my mental health balance in terms of there's a lot of stress out there these days. We're all going through the same process. We're obviously dealing with world crises, really, not just locally. And so everyone has their way to sort of deal with it. I just encourage everyone to find your thing and do it as much as you can. And one of the biggest hurdles always is time, and how do you make time for it? Because we're also very busy, which is part of the stress. It's kind of like a vicious circle. You're too busy to do anything for your mental health, but then being busy makes your mental health worse, and it goes and goes. And so what I do, and what I always encourage people to do, is to have a schedule. As much as you can, have a fixed schedule that you're gonna push yourself to get out there, do your mental health things, if it's exercise, and then really the more you stick with it, the more routine it becomes. It's almost second nature at some point.
It becomes a habit.
What's that?
It becomes a habit.
It becomes a habit, and I know it's difficult, but the same way you kind of get up and go to work when it's work day, you should also do that when it's your mental health day or afternoon or evening, whether it's exercising and whatnot. And so if you have it in your calendar, little tidbit, Google, for what it's worth, did a survey, some kind of research some time ago, and said that you're 33% more likely to do something if it's on your calendar than if it's not. And they were mostly looking at sort of like hobbies and other things, not sort of work that is somewhat already planned.
You schedule it.
So all these other extracurriculars or whatever it is. And so for what it's worth, if that works for you, put it down somewhere. That way when someone else calls or meeting or whatever it is, you can say, hey, that spot is already taken. And so anyway, so I strongly believe in having a firm schedule. If you can add extra, do it. And the weeks it doesn't work, fine, but it's a lot easier to fall back on that schedule than to try to start something new every day. It just doesn't really happen.
Got you. Cindy, what have you been up to now? Those that follow Cindy on social media or whatever can see, Cindy's been doing a little bit traveling, but what have you been up to this summer, Cindy?
Definitely traveling, making up for lost time. So early on, the beginning of the year, I went with a friend and her husband to Jamaica, and that was amazing. And then in June for my birthday, I went to New Orleans, and we'll be traveling some more in November. But in between then, I will have to say that this is the best summer ever.
Okay.
Every weekend from June until now, there's been something to do in Boston, and I'm just amazed. A lot of the events I go to, because maybe we're sponsoring or we're
tabling,
in some way. But I'm just enjoying myself. Having been one of those event producers for many years, I'm so proud of this generation of people that are putting on these events and bringing Black joy to our city. And, this is very good for our health because we've been stuck in the house and a lot of folks dealing with mental health issues because of this pandemic. And I think that these folks are definitely providing this prescription for fun. And one of the things that I know we wanted to make sure that we mentioned how we were staying safe or being healthy about it.
I was going to go into that too. Yep.
Yeah. So making sure that I wear my sunscreen. I have probably 3 levels of suntan. And I have a question for you, Dr. Labre, because some friends, when I'm applying mine, say that they don't need it. Oh, I'm dark skinned, I don't need it. But I just want to sing a song. I got a light skinned friend, look like Michael Jackson got a dark skinned friend. Shut up, James. Now, I want you to clarify that because listen, we all can get burned. So let's go.
Right. Actually, that was the key word there you just mentioned, getting burned. So it is true that melanin, the pigment that provides color to your skin, has some protective effect against cancer. And so, yes, the darker the skin, the less likely you are to get cancer from UV exposures. There is, however, differences in how people's bodies react to UV light, to sunlight. And the key thing is whether you burn or not. Believe it or not, they've found that people who do not burn and just simply tan are very unlikely to get skin cancer from sun exposures.
Okay.
However, if you burn, regardless of how dark you think you are likely at risk still, because the inflammatory response of the skin to UV light, which leads to burning and blistering and peeling and whatnot, is somewhat related to the likelihood of also leading to cancer.
Wait. Hold on, Dr. Labre. We're about to keep this very real because, a few weeks ago, I was in Miami and, I was telling Cindy that my shoulders got a little hot, a little red. Then, just about not that red, Jesus. Then, I had a little peeling. And so what are you saying here?
If you burn, you are at risk.
For what?
For cancer. The C word. It is true. No, if you do burn, so you should be careful and wear your sun protective. Whether it's clothing, there are some types of UV blocker t-shirts, sun, whatever it is out there, and then there's sunblock, obviously, that you can use. And so, yes, the more readily you are to burn, the higher the risk of getting cancer from sun seems to be. That's sort of the way to gauge that. And so if you don't burn, you're less likely to. If you burn, do what you need to do. And the key thing always is to reapply. Don't just put the sunscreen on and be out for 8 hours and think you're protected. Typically 2 hours if you're going to be in the water, because obviously it's getting washed off. Mm-hmm. If you're not in the water, you're just out, you might be able to get about 4 hours from it and whatnot, but you should be mindful of how long you are out. The other thing to know is that sun exposures is not just cancer risk. There is also other types of skin damages that can happen. Actually, wrinkling. Really? You're older than you actually are is also some of the things, because it is somewhat irritating to the skin and whatnot, and so you may not get skin cancer if you're darker and doesn't burn, but you could also be causing some other types of damages and might end up looking a little older than you should at a certain age. So also be careful with that.
Yeah.
Oh my God. All right. So we talked about,
usually your color.
Say that again.
I said, see my tan? Because I'm usually your color.
And so I'm like, I've got burned a couple of times, through the years. So I'm sitting here like, ooh, this is like, it's just not good to hear. So one of the other things that we talked about being safe is, and people, I'll be honest, we've been back and forth outside, at events, masks come off real quick for a picture and things like that. And one of the things we talked about, is staying safe. Cindy, how are you handling, like, when you're vacationing and you go out or whatever? How are you handling, like, the mask, take the mask off outside? Like, because at one point there, I think still now there's like a mental health impact with that, because at least with the mask, you had a different sense of like protection. But then, we've been, vaccinated and boosted. I also want to just herd immunity anymore. We don't hear it. And the thing I think about that is because I think, I'm not going to say they or whomever, but we don't hear it anymore. So I'm wondering if it's just happening. But mask and safety, y'all both can and jump in here. How are you handling that in reference to like COVID?
Well, I'll say that it's become a challenge now that so many people are not wearing it.
Yep.
But I don't wear one when I'm outside, but inside, and particularly when I'm with my mother, because she will rip my head off if I don't. I'm like, Mom, there's nobody in here. It's me and you. So, but it's challenging, being the one person that is wearing a mask.
You're wearing sunscreen and you're wearing a mask. They're going to start calling you Mama Public Health.
And glasses on top of it.
Well, yes. All three of us are in that boat. So, Dr. Labrie, how are you handling it? You're a parent. And, so there's even, of course, your spouse, but, I think it's a different sensitivity when you have children. And then when you have children, we know that children, they tend to carry more germs. I'll just frame it like that. No offense to the kids. But how are you, handling it back and forth? Because you're seeing, to some extent, and Cindy, you too, but you're seeing like the impact of those that don't wear their masks, that aren't vaccinated or vaccinated, but they, still may get COVID.
Sure. So I'll go one step back a little bit to answer your question about herd immunity. So one of the reasons why we're not talking about it as much or anymore is essentially because the vaccine is not blocking the transmission as we had hoped. And so the idea of herd immunity is that if someone is vaccinated, or if we have enough people in the population who are immune, when the virus gets into them, it's sort of a dead end. It stops there. It doesn't continue. And so the likelihood of having big spreads becomes infinitely small, because every time it reaches someone, that dead end, and it ends there, you don't get propagation anymore. Does that make a little sense? Yes. And so because it turns out, unfortunately, by the time we got the virus, we started to have subvariants and whatnot, and it's not blocking it from actually causing some symptoms and transmitting it to other people. So now the vaccinated people no longer considered dead ends where the virus would just go and die and not get to the next person. And so we can't rely on having enough people blocking it so that it doesn't spread anymore. Does that sort of add up?
It sort of does. It basically means, how I interpret that, or try to maybe regurgitate it in layman's terms, is that, and this was a conversation early on, that those that are vaccinated, at least they won't get as sick. And in reference specifically to herd immunity, am I right in hearing that we're not necessarily immune? We are more or less likely to get sick, because immunity means that it doesn't, maybe we need to do a quick.
Sure, in a sense, yeah, you could say that, because you can still spread it, you can still get symptoms from it. It's reducing your risk of getting severe illness, the kind that's going to cause inflammatory lung disease, to need intubation, medication, hospitalization, and dying. So that it's reducing that. So there's partial immunity in a sense, because you're still reacting, making some antibodies, and it's blocking, it's keeping the virus from really taking over and causing this massive inflammatory response in the body. So you get partial protection, not complete protection. And when it comes to herd immunity, it needs to be a little bit more complete, because it's about spread, not about getting sick. And so I think there's been lots of pictures circulating on the internet saying like who you think is in your circle and who actually are in your circle. I don't know if you remember seeing those where they show that like, you know, one person gets it and you give it to 10 other people and each one of those people gives it to another 10. In the herd immunity situation, what happens is one person gets it and you don't spread it. And so
I learned something today, because herd immunity automatically for me meant not as many people getting sick. Herd immunity is in reference to the spread.
Into the spread, exactly. So that the few who are not immune are protected by having so many people around them not spreading it. So even if you didn't get the vaccine yourself, you're very unlikely to get it if everyone around you don't give it to you. That's
right.
sort of
It's just like it's like a real quick thin line to get confused or not, but I think I got it. But it basically boils down to the fact that you benefit more when you're vaccinated and properly boosted. Yep. And also, as Cindy said, when you're going to be indoors with people, to wear your mask. Because another factor that we learned early on is that, and Donald brings up a good point here. Good morning, Donald. He says that there will be asymptomatic people who will not test. Testing is still very important to battle the spread and mutation of the virus. And that's another word that, though we talked about the variant, the virus is still able to mutate, right?
Yes, absolutely.
Okay.
Yeah.
All
so
right.
yeah, and I agree with Donald that is true. It's a bit of a difficult sort of ask to have people sort of how often do you do it every day. But if you have the ability to, if you think you might have been exposed, if you had gone away, if you were in a large group, it doesn't hurt to check. That way you can sort of protect the people around you. And sort of going back to Cindy's point and the question you had asked me earlier, how am I handling this being safe? And we sort of back to the same sort of, it's a balancing act. We do want people to have a life. Obviously, everyone should be able to, and we know the mental health impact of being indoors only, secluded, and all that stuff. It's real. That is a huge aspect of health, because mental health is overall health. And so you need to find that balance between protecting yourself and your family, friends, but also having a life, basically, and being able to do things. And so the way I approach this is always, what's the minimum needed here? The same way I put my helmet on when I get on a bike, I'm still likely to fall off the bike and get in an accident, but I've done what I can. I put that helmet on to protect my head. You get in the car, you put your seatbelt on, you can still get in a car accident, you can still die. But at least you've done your part. You've done the bare minimum, and you're less likely to get ejected out of your car if you have your seatbelt on. And so this sort of similar idea. We know you can still get the virus outdoors, but the chance is a lot less. And because we still need to live, we say, if you're gonna be outdoor, you feel more comfortable not having the mask, don't do it. But no one should look at you the wrong way if you choose to do it, because that's sort of what you believe for yourself. And it's become a little bit more individualized now in terms of how you stay safe. And so know your risk, as you were mentioning. If you have family around, if you live with people who are likely to get really sick from the disease, from the virus, COVID, because they have cancer or have other conditions, you may need to be a little bit more careful than someone who may not be surrounded by people who are at high risk. And so you can take higher risk yourself.
I wanted to bring something up that you're kind of talking about there, and Donald kind of mentions it in his comment. And Cindy, if you remember, right before the vaccine, I want to say late 20 or early 21, we almost had to go on an honor code sort of system. Remember that we were hearing, about situations where people knew they were positive with COVID and they weren't, and they were riding around and whatnot. And so I just want to bring that up, that to Donald's point, that we're almost, to some extent, when it comes to testing, we're almost on an honor code sort of system where, people may be asymptomatic, They tested at home. They know they're positive, but they're just gonna, I'm gonna wear my mask. I'm gonna take my mask off. But no, you probably need to quarantine for like 5 days if you test positive. And so I don't want to get, doom and gloom. We were supposed to do midsummer check-in, but the whole point of this is making sure that next summer you're here. We can check in with you. And again, not to be too deep, but we're going to get ready to start getting ready to wrap up. Go ahead, Cindy. What'd you say?
It's harm reduction.
And that's the thing that is so interesting with HIV, and we were doing smoking cessation with young people back in the day, that a lot of public health, and I know, specifically with like the opioid crisis and whatnot, harm reduction models may not be as embraced, but that's always been like a model of the public health, is reducing harm. I think to Dr. Lawley's point, we can't prevent you from falling off the bike. Somebody driving, you hit a rock, a little small pothole or whatever, you may fall, but the harm is reduced because you put your helmet on. The harm is reduced in being hospitalized from COVID because you got vaccinated or take what's it called?
Paxlovid?
Oh, Jesus, I wasn't anywhere close. the P pill. And so we do have a couple of questions I just wanted to check in. And Pastor Marion asked, does the pill cause false negative? And I know with our president, he had tested positive, he took it, he came off of it for a couple of days, and then he had a rebound, positive again on Saturday. And so that is basically her question. Does the pill cause a false negative? Good question, Pastor Marion.
It's a little difficult to answer because the pill obviously is what we call an antiviral. So it actually affects the reproduction of the virus. So the virus doesn't multiply with that. And so if you are taking the pill and you've reduced the viral load, meaning the number of copies of the virus you have in your body, technically you could get a test that is negative, because the test does change depending on how much of it you have around.
Right.
And so if you have a lower amount of the virus, you could get a test that's negative, but the virus hasn't fully gone. And so you still have some in your body. So in a sense, yes. I was saying it's a little bit complicated to answer because the test is still fine. So it's not that the test is positive but doesn't show it. It's just that the sample is not.
It doesn't contain enough of the virus for you. And I mean, and then if you come off the meds, the virus may try to increase if it's not fully out of the body yet. So it's not a false negative. It's actually like a levels thing, if you will. The test is set to identify positive if it senses X amount of.
It's not set for that. It's just the nature of how the test works. If you don't have enough of it around, it just doesn't really pick it up well. Or like you could get a super faint line if you're using the home test, for example, and you don't really actually see it. You think it's negative, but that might be something there because the number does add up to that. And so same thing when you're doing the home test, we ask that you sort of lightly blow your nose a little bit. That's just to bring more sample to the front. So you want to bring the boogers down to where you're going to swab, because if you don't have it, it just doesn't pick it up. That doesn't mean you don't have it in your body. You just didn't pick it up enough.
In the swab,
idea of swabbing making a few turns and letting it sit, it's just to pick up as much of the virus, if it's there, as possible to guarantee that the test picks it up.
I'll be honest with you. The first time I home tested, I didn't want to test positive, but I had that thing up my nose, you know what I mean? Like I know
what you mean.
Just to be sure.
I mean, this is great, Jimmy. I appreciate the honesty because this is human. This is what people do, and you have that. It's not faulting you. It's not like you're not a bad person for doing that. This is the temptation that we naturally have. Like sort of like denial. You don't want to know. You'd rather not. So you have to really be like pushing yourself. I'm like, okay.
I literally was pushing the thing off, pushing yourself. I would, because that was the number one thing that I remember seeing on the commercials. Like everybody was all upset. So I'm like, let me just stick this thing all the way up, my nose. But thank God it was negative. Cindy, let's get ready to kind of wrap up here on this point, because I think what we talked about, thank you all for being transparent. Dr. Labre, just sit up just a little bit more, because Donald did a whole sermon there. If you love your people, if you love your community, test and do all. This is it. This is the post. Test and do all you can to respect others' rights to be safe. Do not impose your risk on others. Be the solution. Much love, y'all. I mean, Cindy.
He's right.
Shout out to Donald, MGB in the building.
I mean, that really what it is. That is really what it is just making sure we get the information out. And today was like a little light, but we did still include a lot of information. And shout out, we got folks listening from Tennessee. Dr. Labre.
Nice.
So, and this is a very influential person in his area. And so getting, we got spread all the way down in Tennessee, getting information out there. So we make sure we tell Dr. Betancourt that. But no, in all seriousness, it is important that we share the information. Even today, when we presented it in sort of a light manner, folks are going to walk away being reminded. Even I'll say last week, we weren't as stringent in the choir rehearsal that I'm doing, because I think just the nature of where we are. However, the church was aware last night of some stats. Everybody was masked up. They were wiping off the pews. And so, as you said, I think Dr. Labre, we kind of had an idea that this was going to happen, the up and down. I'm hearing rumors that, some public health officials about 45 days, 60 days from now, they're going to be a little concerned because we're going into the fall and kids are back in school. And, so it really is important we stay as aware as possible. I think that is it for us today. Is there anything?
I don't think we've really heard too much from you, Jimmy, about what you've been up to this summer.
I've been chilling. I went on one vacation in comparison to last year, because y'all know last year I was every other week. I've been, we did the thing at the ICA around the importance of, Black and brown people using the waterfront for self-care. Coming up this Saturday, we're doing Java with Jimmy on the City of Boston's open streets.
Nice.
We're doing that there. I went to Walla Walla, Washington, and got to see the Martin Luther King memorial, the Embrace Memorial that is coming to Boston. They're going to start out in November from across the country, and then they'll be here sometime in December. What else did I do? I went to a lot of the events that Cindy have talked about, that Cindy mentioned: BAMS Fest, Boston While Black. MGH is a supporter and member of that. Excuse me. I think that is pretty much it as far as like fun for the summer.
So how would you rate your summer so far?
I would give it a C or B minus, only because I think last year I got addicted to I only spent 6 weeks in Boston from July through October. And so this year, between events and some other things, being a little more frugal, it's because I want to travel. So I'm giving it, generally, I think with the events that I mentioned and whatnot, I'll upgrade it to a B plus. I'm cool. And then, as far as staying safe, I'll be honest, certain spaces, certain rooms, I automatically go in with the mask. And then in some other spaces, I'm a little relaxed. So if you take that first picture, the mask is hanging there, and then you may put it on your wrist, and then you may find yourself, walking around and oh shoot, I need to put my mask on. It is an individual, not only individual person, I think it's also in a circumstance to circumstance type of thing. And so generally, I think that's how, I'm trying to stay safe. And yeah, that's pretty, I put on a little bit of weight, but otherwise, I'm doing pretty good.
It happens. And the key thing is we talked about this back in December when we were talking about the holidays, is don't let it become the new habit, the new lifestyle. So, there's going to be a little up and down, and you certainly want to enjoy as long as you kind of get yourself back at some point and say, hey, maybe this is not a forever thing. Maybe that was a weekend thing or a month thing, maybe.
it's this tire sitting up on my hips has been for about 6 months now, so we're gonna have to figure something out.
I think we need a different session for that one.
I just want to remind people that there is a lot of there are a lot of events that are happening, and they oftentimes have tables that have the COVID test. Be sure to pick up a couple, and if you notice on the back the expiration date passed, it's good for 3 months after that date. So don't throw your test away.
Too late.
I know, but we've been telling people when we have our community care van out, but just in case you are hosting an event and there's someone there that has tests, that is a question that I hear a lot of people asking.
And good point, Cindy. There is one other thing I just found out the other day myself, that a lot of insurance plans are actually allowing people to get 8 tests for free from the pharmacy. So you can actually, you don't need a prescription or anything. You go into the pharmacy with your insurance card. They can and ask if you're eligible for the free COVID tests. Okay. And they'll run it. If you are, you can get up to 8. And that's not per family or per household. This is per
individual.
Yeah.
Per insurance card. Okay.
Yeah.
We're going to end with this. And Leslie, thank you for great information. And we'll just end here. When we were talking about masks, Sister Leslie said, makes wearing your mask cause you to brush your teeth more. And then she said, halitosis is real.
Yep. At one of my first events, I gave away mask mints. Here you go.
We probably overdue for a dental health segment on this show. That might be
overdue. We're way overdue because I don't think we ever did one. So we got to figure out.
Not. We're way overdue. We really should, because that's also another big part of health that sometimes we forget that it matters for lots of the things in your life.
Okay, so we know what's coming up.
Thanks for the reminder.
But Leslie, I had to laugh at that. Halitosis is real. Donald said, "Ooh, she's focused." All right, folks, we're going to get ready to wrap up. Thank you so much for tuning in today. We will be back with you. Stacy said yes, mask and mints. We'll be back with you 2 weeks from today on August 9th, August 16th at 9 a.m. And we'll let you know what that subject will be. But Cindy and Dr. Labre, I just wanted to personally say thank you. This is an awesome journey that we're on. We're hitting a year in like 2 months. August 26th will be a year. Whoa. All right. So I'm looking forward to, a year more. And I did mention to the crew that we were supposed to be together today, but we're working that out along with what I'm trying to do on the regular Java with Jimmy days. We're also looking to bring you better and more and different type of content here in Your Healthy Java. And Cindy and Dr. Labre, it is so dope to have you as thought partners. Shout out to Natalie, Connor, Leah, who else? Geneva, Damien, Renasia, and all the other folks over at the MGH team that make this happen. And thank God for the people over in finance.
The Brigham team, yeah.
And the Brigham folks as well. I just really appreciate you all. And today was real. I think today was one of our like dopest sessions. We haven't been on screen together outside of meeting like this. And so, yeah, I appreciate both of you.
All right. Happy summer and be safe.
You can tell Dr. Labre's ready to go, because usually we'll go till about 10:10. He got something to do. All right. We'll see you guys in 2 weeks at 9 a.m. Thank you for tuning in to Your Healthy Java. Have a great day, everybody. Peace.
Awesome. See you all later.
Everyone.